All right. Hello, and thank you all for joining us this afternoon. Today's Facebook Live will be a conversation about how to prevent opioid misuse. We want to provide factual information with you all and remind you that you have the power to make a difference in your community. So, we have two fantastic representatives from the Washington State Healthcare Authority with us today. And they'll be discussing the dangers of opioids and fentanyl, what to do if you suspect an overdose, how to talk to your friends about opioids, and also why it is important to never share prescriptions. With us today are Jessica Blows, the current state opioid treatment authority for Washington State, and Ndalkachu Abiba, a prevention system manager with the Healthcare Authority's Division of Behavioral Health and Recovery. If you have any questions on any of the topics covered today, please feel free to ask them as we go along, and we'll be answering frequently asked questions at the end. So with that, I'm really excited to be able to introduce today's speakers. Jessica Blows, LMHC SUDP, NCC CCMHC, currently serves as a state opioid treatment authority for Washington State, as well as holds a concurrent position as being the manager of behavioral health clinical support for the Washington State Healthcare Authority. Prior to her current roles, Jessica worked as a regulator of licensing and certification for mental health and substance use disorder behavioral health agencies within Washington State with the Washington Division of Behavioral Health and Recovery. And before coming to Washington State, she spent her direct service counseling career in New York State, holding a variety of clinical and administrative positions in integrated, co-occurring behavioral health treatment agencies that also operated both opioid treatment programs and office-based opioid treatment programs. Ms. Blows maintains active licensure as a mental health and substance use counselor in both Washington State and New York State. And she also holds both an MS in mental health counseling and an EDM in school counseling from the SUNY University at Buffalo in New York State. So we're really excited to have Jessica with us this evening. And Ndalkachu Abiba, MSW, and he's an MPH candidate as well, is a prevention system manager at the Washington State Healthcare Authority's Division of Behavioral Health and Recovery. In his primary role as a prevention system manager, he works directly with 10 community wellness prevention initiative coalitions located in a variety of counties across the state, including Grant, Kittitas, Klickitat, and Yakima County, to administer substance use prevention and mental health promotion services. Additionally, he works on a variety of projects surrounding opioid prevention in Washington State, one of which is serving as a spokesperson for the Starts With One campaign by appearing on local media. He has led and supported a variety of health promotion campaigns in King County, amassing close to 500,000 media impressions. He's also a graduate student at the University of Washington pursuing a master's in social work. So we're really excited to have both Jessica and Ndalkachu with us this evening. And with that, I will hand it over to Jessica, who is going to kick us off with some information on opioids this evening.
Oh, hey everyone, good evening. Thanks for having me. Just doing a quick check, can everyone hear me okay? Awesome. So today we're just gonna start off the conversation actually by talking about even more questions. There's a lot of questions that we get all the time at Healthcare Authority. And I think it's really important to just define certain terms that we're going to be using a lot throughout the conversation today. Another quick thing I want to let you all know is everything that we're talking about today can be found on this great website. It's at getthefactsrx.com, getthefactsrx.com. And again, if you have looking for more information, if you want to see again in writing any of the stuff we're going to talk about, please check out that website. But the number one most common question we get is actually a pretty simple question. It's what exactly are opioids? You know, we keep hearing about the opiate epidemic. What exactly is an opioid? So an opioid really is just a class of drugs that is primarily used historically to help individuals manage pain. And that could be anything from I fell and broke my arm and I need to treat my pain. I've had surgery or dental surgery and I need to have pain management, or even folks who are dealing with chronic health conditions or things like cancer care and who need pain. So there's lots of different types of opioids. There are most commonly known as prescription painkillers. So that can include everything from drugs you probably have heard or seen or even used within your house or your family. It could be hydrocodone, oxycodone, codeine, morphine, and fentanyl. There's also what's considered illicit opioids. So an illicit opioid is really just any opioid that you might be able to get or take that is not necessarily being prescribed from a doctor and you're not getting it from a pharmacy. So this could include drugs like heroin, which you've heard of, which are not prescribed at this point in the US for any treatment and is only an illicit substance. And then also all of the other prescription painkillers we talked about, again, if it's not coming from a doctor or a prescription from a pharmacy, that could all be considered illicit as well. And the reason why we're going to talk about opioids today, like I said, opioids really are meant to help individuals manage pain because it does work on that part of your brain that, helps you manage pain. But also, opioids are really, really strong drug because they do work on other parts of your brain, including a part that kind of we sometimes refer to as a reward center. The reward center of your brain is the part of your brain that makes you do things more and more. So it could be everything from I ate really good ice cream, so I want some more ice cream. Or like, oh, I really, really like this person. I'm going to spend more time with them. These are all actions and behaviors that happen from the reward section of your brain. And opioids actually act on the same part of your brain. So they act on it so powerfully at times that if anyone takes a high enough opioid for a long enough time, it can actually cause your reward brain to make you feel like you need to use it over and over again to either get the same effect, whether that's pain management or relaxation or a sense of euphoria. So that's kind of the reasoning why these drugs, opioids, are considered so addictive. But also, the first part we're also going to talk about is another question we get a lot about. Okay, so we know these are powerful drugs. A lot of times they are being prescribed, though, by a doctor, a nurse, or a PA. So, what do you really need to know if you get offered a prescription for opioids? So, again, opioids can be used legitimately for pain management needs, but you can ask a bunch of questions. You can always ask a doctor or prescriber, why am I actually being prescribed this medication? You can also ask them, hey, are there any other alternative ways for me to manage pain? So maybe I don't have to take an opioid or don't have to take it as long. That can include everything from over-the-counter pain medications to maybe doing different things like physical therapy. You can also ask questions about, well, how long am I supposed to take this medication? How do you know that it's being given to me at the correct dose? Other considerations, sometimes you might want to think about asking your prescriber, maybe either you or someone who you live with, could be a family member, it could be a partner, could be friends. Maybe they've been someone who struggles with opioids and you're just not comfortable having them in the house. So you can always let your doctor know if that's the case. And again, they can usually recommend some alternatives so you don't have to have opioids. Another common thing that you can talk about is really how you should store your opioids in the house in a safe way. And most commonly, we recommend a locking container or a locking bag. And we'll talk more about that later. So we'll circle back and talk about that in more detail. And then also another really big question that comes up is, you should always take medication, usually as prescribed. But sometimes, your pain symptoms might go away before the end of your script. And if that's the case, as long as, again, you've been consulting with your doctor, there are safe ways to dispose of your medication. So you don't necessarily have to either use all of it Or again, you don't have to have extras sitting around the house where someone like a younger family member or again, someone else might be able to get access to them. And I think we're going to be circling back and talking a little bit more about that later as well. But another important thing to know about opioids, like we're talking about, they're so powerful, is it's really, really important to never, ever, ever share your prescription with anyone else. So like we said, when a doctor or a prescriber makes a decision to give you opioids, they're taking all different types of factors into account, everything from your personal health conditions, things like your weight and your height, if you have any allergies, if you have any other healthcare needs. So they're really able to offer you an individualized amount that's right for you and that's safe for you to take. So if you end up sharing your prescription with someone else because it's not being prescribed for them, there could be a chance that you might accidentally be putting your friend or loved one at risk because they may be taking an amount of medication that's not safe for them for a number of reasons. Another thing is that there's also usually state and federal prescribing laws, and there are in our state as well, that limit the amount of medication that can be given out. Because of that reward center topic we were just discussing and how these medications can act so powerfully that it can become easy to accidentally become addicted to them, even if that's not your intention. And again, really the only way to prevent this from happening is to try and never share your prescriptions with other people. So we've been talking a lot also about prescriptions and getting medications through your doctor. But also, like I said, there is a chance that there's also lots of opioids that are out there that are not from your doctor. They're not from a prescription and you didn't get them from a pharmacy. So people can use these opioids to try and relax, or again, to have a sense of like euphoria if they take them and it's not meant for pain. So if that is the case, you know, some people will actually just ask you, can I get some of your opioids? Or you may actually be offered opioids at like a party or if you're hanging out with someone, and it might be something you're just being exposed to use recreationally. So again, since we just talked about how dangerous it can be to just use opioids that aren't actually prescribed to you, there's a couple ways to manage conversations when they come up. So one thing is we don't always have to overthink things. If someone's offering you an opioid or asking you for your opioids, you can always just tell them no. Sorry, man. Don't explain yourself. You don't always have to overthink it. Sometimes it's as simple as just saying no. But then also you could let them know about some of the information you've heard about how dangerous it can be, and that again, opioids that are being given that aren't prescribed to you could actually have all kinds of negative impacts, including overdoses, which we're going to talk about in just a minute. And that, you know, if you're not taking an opioid that came from your own prescription, it's also hard to know where it came from. And if you're purchasing it from a friend or on the street, basically, there's no way of 100% knowing what is in that drug. And it may not even be exactly what you thought it was. So it can be really dangerous. And it's another reason not to share prescriptions. And then also, if you're having a hard time saying no, if someone is asking for an opioid that you've been prescribed, another thing that you can tell them, which is actually really true, is because these medications are can be so dangerous, they're oftentimes really closely monitored. So your doctor actually might call you up and ask for proof and ask for you to come back in and show how much medication you have and see if you're taking it as prescribed. And if you happen to be giving out your medication, can actually get you into a lot of trouble. But more than trouble, sometimes it can prevent you from being able to get more pain management medication where you might actually need it for legitimate pain issues that you're dealing with. So for all of these reasons, you could actually end up being cut off from medicine that you or a loved one needs if you're, again, sharing opioids that aren't prescribed to you with other folks. And again, we're going to have more discussions later today in this call about different ways to have conversations with people. And again, a lot of the information we're talking about, you can still check out getthefactsrx.com. But another thing that we do want to talk about, you probably have heard about this other thing, fentanyl. So a lot of people have heard about this and how dangerous fentanyl is. So what is fentanyl? Fentanyl really is nothing more than just one type of opioid. It can either be, again, prescribed through a doctor, and then in those cases, it's usually monitored and safe. But then there's also fentanyl you can get purchased through illicit measures, either, again, getting it from a friend or a loved one, or buying it from someone on the street. So fentanyl is super, super dangerous because it is actually one of the strongest opioids there are. It can be anywhere from 50 to 100 times stronger than the strongest other types of opioids, which are like morphine. And when we're talking about how strong it is, like even 2 milligrams of fentanyl is enough to kill an adult individual. And when we're saying 2 milligrams, you might be thinking, because I know I'm not like a conceptual person like that, what does that actually mean? And 2 milligrams is as small as 2 grains of salt or like sand. So we're talking extremely, extremely small amount with high potency. So this high potency can really, again, if it's not being prescribed to you for a medical condition that's being monitored in very small amounts, it can actually accidentally kill you. And a lot of times when, again, you're purchasing opioids from friends at like a party, or again, different things, maybe like family members, or just going out and buying some. Like we talked about, the illicit drug market is not regulated in any way. There's no way to know what is in that medication and the drugs you might be buying. And basically fentanyl, we're finding more and more is getting into the drug supply. It can be in a huge number of forms. Sometimes it will be marketed as fentanyl, and it can be in everything from powder or like blotting papers, eyedroppers. But then also really, really concerning, we're seeing this a lot now in Washington state and across the whole country. People are even starting to press pills and make their own pills that look like oxycodone or hydrocodone, but are in actuality cut with fentanyl, and it thus makes it really, really strong. So you might not even be aware that you're taking fentanyl. And then again, no one really knows what's in the drug supply because it's not regulated. So without it being regulated, we're also starting to see sometimes fentanyl is getting mixed in with folks who don't even use drugs like opioids, and it's getting mixed in with things like methamphetamine, cocaine. It can also be getting mixed in with like MDMA. So again, you might not even be trying to take an opioid, and fentanyl is showing up in the drug supply here, and it can be really, really dangerous. And the main reason why we want to focus on fentanyl so much is we're actually experiencing record-breaking drug overdoses in our state right now from fentanyl. So again, there's no way to know what's in your medication. So again, if an opiate was not prescribed to you directly, it can be really, really dangerous, and even just one use can actually kill you or one of your friends. So we just talked also about overdoses a little bit and fentanyl, but my main message I want you all to know today is not that, everything is doom and gloom and like, yes, it's terrible. We're experiencing these huge amount of preventable deaths, but really the main message I want you all to know is overdose, again, is a preventable form of death, and really everyone in our community can play a role in helping to keep people safe and preventing an overdose. But in order to do that, you need to know about what an overdose is and what to do if you know someone who's having an overdose. So an opiate overdose happens when the amount of opiates in someone's body is so high that in addition to impacting things like pain and that reward system, it will actually cause parts of your brain to stop functioning. And that's the parts of your brain that control things like breathing, and they'll cause you to lose consciousness and essentially, stop breathing. And if you know when you stop breathing, you're not going to survive for long, or even if you do survive, you might end up having like brain damage and other long-term impacts. But again, without oxygen, things are going to be fatal. But not all overdoses do have to end in death. And again, there are lots of things that you can do. So the first thing is, if you are using drugs, please do not use alone. You can always start small and use a small tester amount to determine the strength. But if you do have to use alone, there are resources out there. There's a website called Never Use Alone that also has a phone number that you can call. And it's completely confidential, but you would give your information. And then if something happens to you and you're not responsive, they can call 911 for you. But other things that you can do are to just also know what are the signs of an overdose. So usually the main signs of an overdose is someone's total inability to wake up. Their breathing has either slowed or completely stopped. They oftentimes start to grow cool. You might have blue, gray, or ashy skin, especially around your lips or your fingertips because of the lack of oxygen. And it can be a really, really scary thing to do or to witness this, but really you need to spring into action right away. And there's a couple steps that everyone needs to take. The first step is you need to call 911 for someone. A second step is you have to try and administer naloxone. It's also commonly known as Narcan, and that's the opiate overdose reversal medication. And we're going to talk later today more about where to get it and how to obtain naloxone. But this medication actually is 100% safe, and it will reverse an overdose in an individual. And then a third step would be to do things like rescue breathing with someone who's having an overdose. And that's one of the other good things about calling 911. So a lot of us, you know, it's going to be a really stressful situation. You might not know what to do specifically with rescue breathing, and things like 911 can actually help coach you through that as needed. But naloxone, again, can prevent overdose deaths, and anyone in our state can actually get naloxone over the counter from a pharmacy, which we'll talk about more in a few minutes. And that really everyone should have at least 2 doses of naloxone if you or friends are using opioids. And then there's lots of great websites. There's a cool website called stopoverdose.org. That's stopoverdose.org, and you can go there for all kinds of information on this topic. And again, we're going to talk about some other things later, like the Good Samaritan Laws in our state that will protect you if you need to call 911, as well as, again, how to actually find naloxone in your community, where to get it, how to pay for it. But also, I think at this point, I'm going to stop talking about all of these things because I know that Indalkich is with us, and he's also going to be talking about just how to have some conversations with friends that might be really important to have before things kind of get to this crisis point.
Well, thank you so much, Jessica, for really giving us that overview and defining some of the commonly used terms, as well as the shared golden rule of no thanks, right? When being offered opioids, as well as centering why it's so important and critical to never share prescriptions. I believe nearly 75% of opioid misuse starts with people using medication that was not initially prescribed for them. And those medications are often taken from friends or family members. And that's why it's so important for us to start talking about prevention and to really stay ahead of the curve by learning, what are those warning signs, as well as how do we engage in those conversations so we can inform our friends and our loved ones about the dangers of opioid misuse once we recognize those warning signs, right? So in order for us to start engaging in those conversations, we must be able to first recognize what those signs of a problem are. And a common question worth asking is, how do I know, right? How do I, as a friend or a family member, know when somebody's struggling? And as Jessica stated earlier, opioids can negatively impact the reward center of the brain, leading users to need more and more of the substance over time. As a result, these drugs can be highly addictive. And a key part of prevention is being able to have that conversation as early as possible. And in order for you to have that conversation, these are some of the things that you should look out for. So if you notice an individual making mistakes at school or on the job because of the use of opioids, that's a warning sign. Or they are suddenly and abruptly hurting relationships with family or friends, that's also another warning sign. And we touch on this a little bit, which is folks develop a tolerance for opioids, and they have more cravings for opioids over time. As that addiction grows, they need more and more amounts, right, to get high. And so if you recognize that, right, the tolerance is increasing and they're also seeking more, that's a warning sign. And lastly, if you notice that an individual is trying to stop or cut down on opioid, but they're also unable to, those are some of the warning signs that you should be looking out for. So in the case you notice one or more of these warning signs, whether it's from a friend or a loved one, it's very important to start considering, having that conversation, and quite frankly, what that conversation may even look like. And, I can speak from experience in trying to say that addressing and being engaged in these conversations can be challenging and they can be very difficult. The nature of the conversation itself is very challenging. And oftentimes talking about drug use can be tough and it can be awkward, but it could also be the most important thing you do. And, I don't want to understate this in saying, you're saving a life and being an active member in the health and well-being of somebody else. And in terms of, what that conversation may look like, it was really relying upon you and your approach and your capacity to have that conversation. When I say a conversation, it doesn't have to be this extremely daunting and heavy sort of therapeutic-like session. Really, one of the best ways to engage and start that is to approach it in a very casual manner. Similar to how you would talk about a recent event or, sports or news. And quite frankly, now that I mentioned them, those could even be great segues to engaging in these conversations. So in essence, by keeping the conversation casual, you can keep it light, and it doesn't have to be, again, a therapy session or an emotionally loaded topic, but rather part of a conversation you could have at any time with your friend. And if you head over to some of the resources that we have for Starts With One, those conversations can really be 30 seconds, right? They can be as low as 30 seconds. And those videos model great conversation starters, and you're quickly addressing it and moving on. But if there is a need to have a deeper conversation, also making yourself available for that is very important. And if I could emphasize one thing, one key item is to really do more listening than talking. And as the conversation is taking place, really allowing your friend or your loved one to share their experience. I recommend putting that empathy and understanding sort of front and center. And I want to, it can be so tempting, to hear almost what you want to hear, that your friend is okay and that there are no issues. But rather, focus on the listening component, right? Listen to what your friend is telling you, but also, what are they not saying? And if you feel the need to ask questions, I think it's right to be inquisitive, right? What you can ask, what do you find particularly challenging, right? Or what are areas that you find joy, right? Like what brings joy to your life, and then explore where there need to be opportunities for some encouragement and some support. And so these are great areas to explore. And as your friend or your loved one is sharing, it's always important to repeat what they say, just to make sure that you're listening and showing and demonstrating that you're actively listening, right? Some of the things you can say is, am I hearing correctly that? And then basically reciting or summarizing what they told you. Or even saying, can you tell me more about that, right? That's a fantastic question, right? So if somebody is expressing a thought, ask them, can you tell me more about that? Another thing to keep in mind is to avoid offering advice or trying to solve the problem if there is one, and instead just be there, just be there and then hear them out. And sometimes it's very difficult to do, but that's just be there, hear them out. And at the end of the day, I think, we all want to be truly heard and understood, and having these conversations really centered on how we care about the well-being of one another is a great way to establish trust. And trust is really built over small instances like this, where you're engaged in tough conversations about each other's health. And if you recognize that this conversation is really necessary, you can start by communicating to your friends that there's always an avenue if they want to reach out and talk to you, right? It's always good practice to remind your friend that, hey, whenever you need me, I'm here to talk. And when they take you up on it, really like giving them your undivided attention. And the likelihood that they may even take you up on it may be slim to none, but the chances are there may come a time when they may leverage that opportunity. And when they do, really be the person that's there to listen, be the shoulder that they can lean on. And as you look ahead to the conversation, really prepare yourself by removing as many distractions as you can and make the conversation the most important thing taking place, because it is. And many folks are juggling work, school, activities, and it can be very challenging to connect. But first, identify when you're available, when you're both available, and carve out a specific time and date, but also carve out a specific activity where you can maximize that limited time by grabbing lunch or working on a project or an activity together. And while these conversations are taking place, focus on offering support and not judgment. It can be so easy to have that immediate and emotional reaction to something your friend says, especially if your friend is experiencing a challenge, and rightfully so, because you care, right? Because you care about your friend, you care about your loved ones. But as much as you can, really take that pause before responding, and ask yourself, like, how can you react with compassion and really be that healing presence in your friend or your loved one's life? I recommend instead of immediately reacting, think of questions that you could ask, right? About their experience, about their feelings. Ask about some of their support networks, right? And assess whether those support networks are strong and how you could improve them. How you listen and respond to your friend in that instance goes a long way, again, in establishing that trust and the chance that they will come to you in the future if there is an issue, right? This may just be an immediate conversation, a 30-second conversation, but this might go on for length. And the more you have it, the more trust you're able to build. And I would really like to emphasize that, you're not alone in this process, that there are resources specifically designed for you, conversation starters that you could find to the site that Jessica referenced earlier, getthefactsrx.com. There are resources around research. There's resources around conversation starters, which are extremely helpful. Additionally, if you feel like you don't have the capacity to really move that conversation forward, always connect with a trusted adult, right? A school counselor, a local health center, or if you're in a high school setting, there are student assistant professionals that are very well equipped to handle some of these challenges. And currently, there are 82 CPWI, so Community Prevention Wellness Initiative coalitions across the state. So if you find yourself drawn to the mission of combating opioid misuse, this is really a great opportunity for you to get involved, right? So going above and beyond that conversation and really being that changing agent in your community. I think that's some of the biggest lessons that we took from the past year. Health is very important, and that we should all play an active role in ensuring not only the health and well-being of ourselves, but also our peers and our community members. With that, I'll hand it off.
Thank you so much, Andalkachu and Jessica as well, for running through that really important information and being able to educate a little bit more about this important topic. So I know that we often get a lot of questions from folks who want to know more about opioids, about overdose. And so I thought we would use a little bit of time today to just run through some of these frequently asked questions that we receive as well, to educate a little bit more. So we're just going to start kind of our Q&A section for this evening, and I'll just bounce back and forth between both of you if that works. So one of the most commonly asked questions we get is, if someone suspects that a friend or a family member has overdosed, will they get in trouble if they call 911 if they have also been using drugs? Jessica, I'm wondering if you could help answer that one for us.
Sure. So that's a really great question. It's a really common question because, as we talked about before, yeah, sometimes opiate use might be illegal. So it's natural to worry about if I call and get help, if I call 911 and the police come, am I going to get arrested? Is my friend going to get arrested? What's going to happen? So our state is actually really, really cool in that Washington state has what's called Good Samaritan Laws. And really, Good Samaritan laws are just a fancy way of saying that if you are calling for help for someone who's in need of medical assistance, especially related to an overdose of any kind, the police are legally not able to charge anyone with anything related to possession or other drug-related crimes. And the whole point of why this law was put into place was to try and let people know that they don't have to be afraid, because also we talked a little bit about this when we were talking about overdose, but it's so important to call 911. I should have mentioned this more earlier, but even if you give someone naloxone and they recover from an overdose, the opioid sometimes can be so powerful that the naloxone or the Narcan in that person's body will be effective for a couple hours after you administer it. But then there still might be so much opiates in the person's body and floating around in the brain that the person actually can slip back into an overdose. Really, the only way to prevent that is to get that person help and get them checked out at a hospital, and also to make sure they haven't had any long-term effects from, like I said, the lack of oxygen to vital organs in their brain. But again, you can't do that unless you call 911 or get that person to a hospital. So again, the only bad thing about the Good Samaritan laws is I feel like not a lot of people know about them. So that's another thing too. Could be another talking point to talk about with your friends, because I think a lot of people don't know that legally you cannot get in trouble in Washington state with law enforcement if you call for help if someone's having an overdose.
Thank you, Jessica. I think that's extremely important. And while we're on that topic, can you also tell us a little bit about naloxone and where someone would be able to get that? Is it expensive? Tell us a little bit more about that.
Sorry, I went on mute again. Sorry. And so great question. So there's actually lots of different places you can get naloxone. If you are getting opioids from your doctor, like I said, a prescribed opioid for pain management, and you're kind of worried, or you just want to have some naloxone in the house in case a family member or maybe like a younger sibling, someone might get into it and take it by accident, you can actually always ask for your doctor to prescribe you naloxone. That's one way to get it. And then, of course, you would just go and fill that prescription at a pharmacy. But I think another way that a lot of people don't know about is our state, again, it's really cool. We have this thing called a standing order, where basically the Secretary of the Department of Health has written basically a prescription for the whole state that's wide open for anybody, that allows anyone at any age to walk into a pharmacy and ask for naloxone. So you can just go right up to the counter and say, hey, I'm interested in getting some naloxone. You have a couple different ways you can pay for it. You can either use your insurance benefits if you have insurance through like your employer, or maybe through your parents, or things like Medicaid, Medicare. Pretty much all insurances at this point cover naloxone with very little copays or prior authorizations. So there's also, again, that cool website I was telling you about, stopoverdose.org. They even have a naloxone map where you can type in your address and it will tell you all the places in your community, including all the pharmacies where you can go to get it. Also, sometimes though, you might not really want stuff on your record, and I get that. So maybe you don't want your parents to know you've used your insurance benefits for that. You can also choose to pay cash for naloxone, and it's usually around $60 for a nasal form. And there is a cheaper form that's an injectable form that can be harder to use sometimes. and that's usually around $30-ish. But you can also always just go and have a conversation with the pharmacist or call them up ahead of time to see, do they have it in stock? How much is it going to cost? Will they take your insurance before you go? So that way it can also save you a trip or let you know what to expect when you go there. And then also there are other sometimes community groups that may have access to naloxone, everything from syringe service programs or other types of, again, community like mutual aid groups will oftentimes have naloxone. So you can go into any syringe service program in the state and ask for free naloxone. They'll just hand it over to you. So that could be another option if financial resources are difficulty. And then it also could be a good thing to just talk about. The Surgeon General actually had a recommendation for the whole country that every business and every setting, basically schools, employers, community places, whatever, everyone should be carrying naloxone because it's just such a big deal right now, and so many people are dying of this preventable form of death. So it could be a good question to ask your employer, your school, whether it's a high school or university, is there naloxone? Do we know where it is? And do people know how to use it? So those can be all ways to think about how to get access to this life-saving drug.
Those are great points. Thank you, Jessica, for sharing that. And Chewy, I wanted to go to you with this question. One common concern that we hear at the Healthcare Authority is that people have anxiety around saying no to a friend or seeming uncool if they're offered opioids or a prescription that isn't theirs. Can you give an example of, how to say no if a friend offers you some pills that aren't yours?
Great question, Annie. This is really an opportunity to sort of reiterate the golden rule that Jessica highlighted earlier, which is just saying no thanks. When offered opioids which are not originally prescribed to you. Another strategy is to just make it very casual, right? Don't make it a big deal. Instead, highlight some facts, right? Hey, opioids are very dangerous in that, my body may react different, right? Because this medication was not originally prescribed to me. So highlighting that. But in all honesty, that second component is unnecessary, really just saying no thanks and being confident in knowing that because you're centering your health and well-being should be sufficient.
Thank you, Chewy. And kind of similarly, Jessica, I'm wondering if you can talk a little bit about when someone might raise a concern about a friend or a loved one to a parent or a trusted adult. When do you know that it's time to perhaps get someone involved if you think someone is abusing or misusing opioids?
Sure. And I know, Andalka, you did talk a little bit about this earlier, and I thought you did such a great job. But you're right. I think the main thing is, first of all, you can always just have that conversation yourself with your friends. Sometimes you don't always have to bring in other people. Just letting people know that you care about them and you've noticed these things and you're concerned, that can be a really big help. Your friend may not always want to talk about what's going on, or maybe even the effects of the brain might keep them from, when you're under the influence of certain substances, sometimes they're not going to be able to always act on your discussions, you're talking with them, or any advice. But really letting someone know that you're bringing it up because you care and that you're concerned. It's because you want to be there for them and that they're not alone in whatever they're going through. All of those things can be really, really helpful. It comes back to trying to stay non-judgmental, being patient. A lot of times, sometimes when people fall into drug use, they also end up, kind of hanging out with different groups of friends and like different social groups where maybe hanging out and partying is what everyone does. So they're afraid to stop using because you're worried about you're going to lose this connection with other people. So again, there's a saying that the opposite of addiction is connection. And I think that's so true. So letting someone know, again, that you care about them and that you're just worried and you want to talk with them. That can be really important. But I think another thing, I know you were mentioning when to bring in other trusted folks. And I think that is an important thing to consider, to know that you also don't have to feel like you're alone in this. Like I said, you can go to that website, get the FAQs RX, to check out different conversation starters, but sometimes, you need support. And in the same way, someone who's dealing with a substance use disorder, we would never ask someone who has cancer to be able to know how to cure themselves on their own. In the same way, we would never ask someone like you helping someone with cancer to be able to cure that person. So I think you need to have kind of realistic expectations to know, we all need support, and sometimes we need support from everything from trained healthcare professionals, but also just support from loved ones. And I think it is okay to reach out for help, especially if your friend is telling you things that have you really concerned and you're not sure what to do. And a support can be anything from other friends, parents, other trusted family members, family friends, teachers. I mean, really, the only thing you probably should not do is, or I guess the only bad thing that really you could do would be, if you are concerned, is to not say anything. And I think I think that's the only thing that you can do wrong in this situation. And I don't know, Indalkachu, if you feel like there's anything else that would be helpful to mention here.
I think you did a great job, summing up some of the resources that are available to folks if they don't feel like they have the capacity to address or even engage in these very difficult conversations. And one thing I highlighted earlier is that there are student assistant professionals at schools and school counselors that you could tap to, or you could tap in as resources.
Yeah.
And so don't be afraid to ask for help. Folks don't expect you to be an expert, and so there's no need for that. Just make sure you reach out to your resources and utilize them as needed.
That's great. Thank you both for your great thoughts on that. I love your point, Jessica, that the opposite of addiction is connection. I think that's really powerful for us to remember. I just have two more questions left as we kind of begin to wrap up this evening. And Indalkachu, I wanted to go to you with this one. And this is a very common question that we get is, if I'm prescribed opioids by my doctor, shouldn't I take them? A doctor is a trusted medical provider. So can you talk about what someone can do if they're prescribed opioids by their doctor?
That's another great question, because it's coming from a trusted source, which is your primary care provider. And I think one of the things that you want to keep in mind when engaged in a relationship with your doctor, you want to also acknowledge that there are multiple opportunities for treatment, right? There are alternative forms and alternative options for pain management. Like you could use ibuprofen or you can ice, and you can also have the option to ask for a partial fill. And I think that's one that oftentimes is not acknowledged, right? You could just say, hey, I don't need this much, right? Let me just take half. And I think knowing your options is a good way. So knowing that there are alternative forms of treatment or alternative forms of pain management. Also recognizing that you can request partial fills. And if there are leftovers, we can touch a little bit about how to properly dispose them before we end this webinar.
Yeah, that's a great segue into my next question that we get a lot is, say you do have a conversation with your doctor and you decide that you do want to, be prescribed opioids. That's the best option for you. Perhaps you request a partial fill and only, ask your doctor to give you a few pills or as many as you might need for just a couple of days after a surgery, for example. But I think it's also important that we remember that 75% stat, right? 75% of opioid misuse starts when someone uses a medication that wasn't prescribed for them. And even more alarmingly, a lot of the time it's a friend or a family member. So they're just kind of falling into the wrong hands. So can you talk a little bit about if you do have an opioid prescription you're, taking at home, how can you make sure that they don't fall into the wrong hands?
That's another great question, and I'm glad that you're centering that question because folks are really thinking about not only their own health and well-being, but also those around them. And some of the simple steps that they can take are, securing a locking bag, having a locking device, and keeping them out of the hands of those who their medication is not prescribed to. So another great option is you could order medication lock bags on Amazon, or if you have a local CPWI coalition near you, they may be able to provide you that for free of charge. And one of the things you should always remember is never store your unlocked medication in a bathroom where others can easily access it, or open cabinets that are easily or readily accessible. So keep in mind medication lock boxes, as well as safe, secure storage where other folks can't easily access it.
That's great. Thank you. And one other tip I know is that even if people have a safe at home, where they keep things, they can also just use an existing method for locking things up, like a safe, or even if you have a drawer that locks and has the key. I think those are also great alternatives. Thank you. Well, we're coming up on time now. So I just wanted to kind of round us out for this evening, and just thank everyone for joining tonight. We had a great time. We hope that you know, took away some important information from this conversation. The information that we shared, I want to remind everyone, is available on getthefactsrx.com. So it's www.getthefacts and then rx.com. So information that we covered this evening, such as, information about opioids, what opioids are and what fentanyl is, how to have a conversation about opioids, and why you should never share prescriptions, can all be found at that website. It's part of the Healthcare Authority's opioid misuse prevention campaign. And I also want to invite you, if you have a question that we were not able to get to, we didn't cover this evening, you are more than welcome to email our wonderful speaker, Jessica Blows. Her email address is noted on your screen there. So feel free to send her an email if you have, a specific question that you'd love to have answered.
And actually, Annie, can I make one more? Do we have time so I can give one more comment?
Yeah,
before we kind of wrap up.
Jump in.
I guess one other thing that I just kind of want to also end on a note, we've been talking a lot about opioid use, and as we've been talking about it, not all opiate use means someone has an opiate use disorder, but there are some folks who maybe have been using opioids for so long that now they actually have a substance use disorder. And we just want to remind everyone that, again, another really effective form of overdose prevention and a way for people to get better is to look for treatment options. So we actually have a bunch of really great resources. If you or a loved one need help with substance use, mental health, or issues with problem gambling, you can actually call it's a website too, the Washington State Recovery Helpline. It's warecoveryhelpline.org. That's warecoveryhelpline.org. You can go there and get the phone number, or again, check out the website, but it's a free, totally confidential, 24-hour-a-day, 7-day-a-week helpline where trained professionals will help you or a loved one find the different treatment options that are near you, near your home, and then that will take the types of insurance you have, or if you don't have insurance, they'll help you find an option that might be affordable for you. And especially with opioids and opioid use disorder, there are actually really, really effective treatments. It is one of the most treatable forms of substance use that anyone can have, but you have to have access to the right treatments. And that includes taking medications that are used to treat opiate use disorder, things like methadone, buprenorphine products, otherwise known as like Suboxone or Subutex, and the naltrexone products, which can also be known as Vivitrol. And we know that actually medications like methadone and buprenorphine can reduce your risk of having an overdose by over 50%, which is huge because there's almost no medications that are that effective for anything. So again, just wanting to put that out there that, as Ndalkachu said earlier, prevention works, and treatment is effective and available, and people can and do get better and they can recover. So if you or a loved one needs treatment, please connect them with the Washington State Recovery Helpline. And then also the University of Washington has another cool website called findtreatment.org, findtreatment.org, and you can find more information on treatment there as well. But thanks for letting me throw that in there, Annie.
Yeah, no, that's great. Really important reminder that there is a lot of treatment options out there for folks. So I also wanted to just note that we will be posting a recording of tonight's information session on this Facebook page, the Washington State Healthcare Authority. So be sure to keep your eyes out for that in the coming days, and feel free to share it with your friends and family. But other than that, we thank you for your time this evening, and want to remind you that you can have influence and make an impact on your community when it comes to preventing opioid misuse, and as well as finding support and treatment for those who might need it as well. So with that, I think we'll sign off for tonight, and keep an eye out for our next information session and Facebook Live that will be posting information on very shortly. So thanks, everyone. Have a good evening.